we'll get started. Thank you. We are really excited about today's webinar. Before we get started, for those of you that are not familiar with the HLA, we are a leadership, management, and quality improvement training institute that offers a menu of programs to support the capacity development of healthcare professionals across Africa. Every month, we offer a lunchtime webinar series as a part of our professional development tools in supporting our stakeholders. This month, we are really excited about today's speaker, Unoma Grant. So let me give a brief background. Unoma Grant graduated from the University of Cape Town in South Africa in 2009 with a Bachelor of Science in Mechanical Engineering. She attended the Senior Management Program at the Lagos Business School in Nigeria in 2016, the Health Management Program at Pan-African University's Enterprise Development Center in 2018. She is a healthcare administrator with over 11 years of proven experience leading transformation in complex organizational structures, as well as devising and implementing successful strategies during startup, growth, and crisis phases. Core to her achievements are having led the process transformation that saw Paelon Memorial Hospital become the first hospital in Africa to obtain a 5-star safe care rating. She also led all expansion projects that grew Paelon from a 6-man clinic to a 13-bed hospital employing 117 people. Most recently, in response to the global COVID pandemic, the management of Paelon opted to convert its Ikeja branch to a fully dedicated 11-bed COVID-19 treatment center. She oversaw the conversion and finalized the necessary facility process and manpower changes. This month, we are really excited to invite her to speak on Redefining Healthcare, the future of quality healthcare in Africa and Nigeria. Unoma, thank you so much for joining us today.
Thank you for having me today. I hope you can hear me.
Yes, we can. We can. So we'll, for those of you that have joined us, we'll allow Unoma to do her presentation. Then afterwards, we will take questions from the audience. So what I encourage you to do is locate your chat box on the bottom and type in your questions there, and we'll take them in the order in which we receive them. Unoma, I'm giving the floor over to you. Thank you so much.
Thank you. Good afternoon, everybody. My name is Unoma Grant, and I'll be talking today on Redefining Healthcare, the future for quality healthcare in Nigeria. So the outline, I'm going to give a brief introduction, although I think Anneli has said everything that there is to say. We will talk about the current state of the healthcare system in Nigeria. We'll talk about how we got to where we are. We'll talk about where we want to get to, and we'll talk about how to get there. So like she said, I'm the Chief Operating Officer at Paelon Memorial Hospital. I've got an engineering background. So this is where the disclaimer comes in. I'm not a doctor. I've been around doctors my whole life, but I'm not a doctor. And so I'm giving you a non-medical medical perspective because I have been working in the industry for over 8 years. I helped start the hospital 10 years ago, but I only joined it full-time 8 years ago. And so I do have, having been in the industry for so long, I think I do have some valid opinions to give about how, we can improve the quality of care that we have generally in Nigeria. So let's start by talking about the current state of affairs in Nigeria. I think right now, most hospitals in Nigeria, private and public, are practicing what I like to call trial and error medicine. We don't do point of care tests before we diagnose most of our patients. A lot of what the doctors are doing, they're going based on symptoms and patterns and what they think and what is most likely the problem. While this system works and is a and can appear to be cheaper, even though it really isn't in the long run, it leads to poorer outcomes. For example, before Paelon started its COVID center, most of the patients who ended up in treatment, which led us to start the COVID center, had been treated for malaria for a week, 2 weeks, before finally the doctors realized that this is not malaria. Now, for you to be treating someone for malaria for 2 weeks means you have not done any tests. You haven't, you didn't diagnose malaria. The symptoms are similar, and so therefore you're treating for malaria. We lost quite a few people who lives that could have been saved if we knew that they had COVID from the beginning and we were directing our efforts in the right direction. Now, having this poor outcomes that we get from trying to, for lack of a better word, trying to save cost, has led to a general distrust of the healthcare system in Nigeria. Any Nigerian that can afford healthcare abroad goes abroad. And even for those of us who can't afford to go abroad for healthcare, we prefer to self-medicate than to go into the hospital. So you feel a little sick and you just go into a pharmacy and you and the pharmacist have a short discussion and you treat yourselves. And now because of all that is going on in the healthcare system, we're losing at least ₦1 billion a year to medical tourism. Our doctors are leaving in droves. I was at a send-off for a doctor last week, and I am currently talking to another doctor now in the hospital who's just finished writing PLAB, and it goes on and on, and the doctors are not staying because the pay isn't great. There's not a lot to do in terms of specialization, in terms of specialist surgery, and all the things that make being a doctor exciting, so they're leaving to go do these things in other countries. Now, why are we here? How did we get here? First, the cost of providing healthcare is high. We're not going to pretend it's not high, which is part of the reason why point of care tests are generally, I wouldn't say avoided, but if it makes the care cheaper, if the doctor thinks they know what's wrong without doing a test, it's cheaper for the patient, it's cheaper for the hospital. And then even the things that we used for treatment, for diagnosis, most of these things are imported. They're dependent on the dollar. And so as the dollar goes up and down, the cost of healthcare goes up. Already, running a hospital is not the most profitable business in the world. And so as much as possible, these healthcare providers are trying to save cost. Then as a people, generally, we have fairly poor health-seeking habits in Nigeria. Most people won't go into the hospital till they are gravely ill. Like I said, we self-medicate a lot. And so you're self-medicating, and then it's up until the last minute when almost nothing can be done, or when what needs to be done is ridiculously expensive. And then that's when the patient starts showing up in the hospital. We have low HMO rates. This is because of a low uptake in health insurance. And we'll talk about this a little more later on in the webinar, but the low rates mean that the doctors are also trying to save costs. The healthcare providers are trying to save costs to make healthcare affordable, to make it profitable rather for the hospital. And this in itself leads to other problems. Then of course we have the regular business challenges that everybody else has. Water, power, just running a business in Nigeria, these things add to the cost of what is already a very low margin business. Then we have the low salaries for healthcare workers, which is also related to the low rates that people are paid, the high cost of providing care. And so healthcare providers are cutting costs wherever they can. And so our healthcare workers are amongst the poorest paid in the world. And so this will lead to them seeking opportunities in other countries where they are better paid. And so now in Nigeria, I think as the last time that was checked, we have 1 doctor to 10,000 Nigerians. I think it might even be more. Might be less rather. And it should be, I think, 1 doctor to 1,000 people in a country. We've had historically poor outcomes because of all these reasons that we've talked about. Fewer doctors taking care of more patients. Regular health, the business challenges, power goes out in the middle of a surgery. The surgeon knows what to do. Everybody knows what to do, but then the power goes out and then you lose a patient. Things that are completely out of our control. So where do we want to be as a country? Where do we think we want to be? First thing we want to do is start having excellent outcomes. More people recovering faster from all the ailments so that we can increase the confidence in the Nigerian healthcare system. Right now, we're stuck in a terrible loop. And so until we can get the average and even beyond average, the 1% to trust our healthcare system, to feel that I don't need to leave Nigeria to get excellent healthcare. Nigeria has produced some of the best doctors in the world, even though we do have one of the worst healthcare systems in the world. So we need to increase confidence. An increase in confidence will increase the amount of money, that 1 billion that we're losing to the diaspora every year, we will be able to get that money back into our system. We also need to lower the cost of providing healthcare. Any way we can, lower the cost of providing healthcare so that the margins, so that the doctors have a wider margin to play with in terms of providing quality healthcare to the patients, so that the healthcare becomes affordable for everybody. You know, we want universal coverage, health insurance. We want good health-seeking habits. We want more profitable hospitals, because profitable hospitals are able to pay their doctors a better wage, and this will lead to a brain return. I'm not talking about a brain gain. I'm not even looking to getting expatriate doctors right now. I'm just looking for the doctors the Nigerian doctors who have left us, to have better opportunities here than they do anywhere else, to come and be able to earn a livable wage, especially for the work that they do. So now, how do we get there? There are four stakeholders in the healthcare system in Nigeria. Some of us will fit into 2 or more places. I think all of us are patients at some point or the other. Then some of us are healthcare providers, the health insurance companies, and the government as well. So these are the 4 stakeholders in the Nigerian healthcare system, and each stakeholder has a role to play. So we're going to start with the hospitals, the healthcare providers. The first thing is, at least I think we need to start having quality improvement programs. There are so many quality improvement programs out there, and Paelon is a good example of a hospital that has gone through a quality improvement program and what difference it has made to the quality of our outcomes. So at Paelon, we did the Safe Care, which is more affordable than, COSASA or Isquan or the other more expensive ones. And Safe Care is great because Safe Care is tailored to the continent. It's tailored to the challenges that we experience as a country and as a developing country, essentially. So Safe Care is not asking you to have the hallway to your theater be 2 or 3 or 4 meters wide so that 2 gurneys can go past each other. They understand that there are space constraints, that there are all sorts of issues that we deal with. What Safe Care makes sure is that you have a checklist in your operating theater, so that no matter how tiny the operating theater is, and even when there's no power, you can still have a clean surgery and you will have a patient recover without any infections. So they're focusing on things that will improve the outcome of that will improve the outcomes that you have, and ensure that the hospital is able to do all the things that need to be done for the patient with whatever resources the hospital has. So I would encourage hospitals to first seek quality improvement programs. No matter how small the hospital is, there is a quality improvement program for everybody, something that will address SOPs, facility management, things that we take for granted but make such a big difference. A couple of weeks ago, my dad came into the hospital, and being the CEO's dad, he thought, oh, I don't have to do my vitals, I'm just going to go see the doctor. But because Paelon's SOPs are strict, and it's even part of the EMR, you can't see a doctor without your vitals. I'm like, sorry, you have to go do your vitals. These are all things that were put in place for us by Safe Care. So he did his vitals, and it was in doing his vitals that we realized that what he came to the hospital for was not what was wrong. So These SOPs actually help you get it right the first time, every time, which is what Paelon strives to do. So he came in thinking, oh no, he just had an ulcer. And it turns out that it was his blood pressure. And it's just a standard part of our SOPs. And this is something that could have been missed very easily if we had just gone over the system and had him see the doctor. They would have treated his ulcer and God knows what would have gone wrong. So these SOPs do make a difference, you know, and then because we have the SOPs in place, power outages and things like that are very well controlled. And even when they occur, we have a plan so that we're never caught in the dark. Next would be evidence-based medicine. While I understand that this increases the cost of care in the short term, it actually reduces the cost of care in the long term. When you have point of care tests, rapid tests that are 80-90% accurate most of the time, a doctor can actually find out in real time what is wrong with the patient and treat the patient there and then, as opposed to a patient coming, going back. And then what ends up happening is that the patient comes to the hospital 6-7 times for the same thing before they actually find out what is wrong. The patient has ended up spending maybe 3 times what they would have spent if they had just done a point of care test at the beginning. So we need to get our minds to a point where we are practicing evidence-based medicine. We don't treat until we can prove that this is what is wrong, so that we're not overloading our healthcare system with people coming back for things that could have easily been diagnosed, treated, and taken away. And SOPs as well are part of the evidence-based system. If your SOPs, if you have proper guidelines that, you know, direct you to through your triage process and all of that, you are able to make sure that you're diagnosing your patients as quickly as possible and having them treated right away. Better pay for healthcare workers. I cannot emphasize this enough. I have seen some of the brightest minds of our generation leave us to work in countries where they will they will probably be very well appreciated, but you know, it's sad that these people are they're born here, they're raised here, they're trained here, and then they're all leaving us for the UK and for Canada. We need to pay our healthcare workers better. However, because I know what the cost of providing healthcare is, I realize that paying better will drive up the cost of care. And once the cost of care goes up, it means that our patients will need to pay higher bills, and we would need higher rates from the health insurance companies. The health insurance companies right now are doing their best. They're trying to make sure that all their subscribers get the best care they can for the amount of money that they pay. They're trying to provide value, but they're struggling. And so why? What can the health insurance companies do to get better coverage for people and to be able to pay the hospitals slightly more so that the hospitals can pay their employees more? So I'll talk a bit about the types of health insurance that we have. Globally, there are 4 major types. We have the HMOs, which is what is most common here in Nigeria, like AXA, Mansard. We have the EPOs, which is the system that I think the NHIS in Nigeria actually uses, is the most similar. We have the point of service plans, like for people who know Global Benefits Group, it's an American, I think, or Canadian HMO. And we have the PPOs, which are like Bupa, the bigger, more fancy ones. So this just gives you a brief overview of the different types of health insurance and how they all work. So the HMOs, you need a primary care physician. It doesn't cover out of network coverage, and it will only cover referral to a specialist if you're within a gated HMO. These are the cheapest ones. The EPOs are also very similar, and they're also very cheap. Then you have the more expensive ones that are able to provide coverage and give you refunds. These sometimes come with deductibles and things like that. So, but we're going to focus mostly on HMOs because that is the most common system that we have in Nigeria. So how the HMOs work, if you look at this little chart here, the way the HMO works is that you have the the patient, who is linked to a primary care provider, which is why most HMOs, for people who have coverage, will ask you to pick a hospital rather. Now, your hospital will have services that it provides, and those services are covered, and you don't require a referral. Now, you don't require, yes, a referral, but then you have a host of services that may not be provided by your primary care provider, but you would need a referral from your primary care provider to access. So you go to the hospital, you say, oh, I need to see a cardiologist. There's no cardiologist in your primary care provider's hospital, and so they write you a referral letter. Anything outside of the HMO's network, you will have to pay for. Now, what allows the HMOs to be profitable is when they have a high volume, which is a large number of people subscribing to the HMO, and low utilization. This allows them to do two things. It allows them to charge a low rate and still provide quality care. So you have 1,000 people paying AXA Mansard for coverage, and only 10 people are using the insurance on an annual basis. So from the money that they are collecting from 1,000 people, they are able to give these 10 people the best quality of care. And they are also able to reduce how much the 1,000 people need to pay. So once an HMO is able to achieve a high volume, which is high subscription, and a low utilization, then they are successful. They're able to pay the hospitals well. They're able to provide better coverage for people who actually need it. Which now takes us to the HMO conundrum. What we are trying to achieve as Nigerians is universal cover. We want a case where every Nigerian has health insurance, whether it's with the NHIS or whether it's private. Now, for us to have universal cover, we would need, and that's for the HMOs to work, we would need high volume and low utilization. For us to achieve high volume, the HMO rates, the premiums need to be affordable. They need to be low. A huge chunk of this country lives under $2 a day. For these people to be able to pay for health insurance, it needs to be low enough for them to afford. Now, because the premiums are not very low, we have a poor HMO uptake. So a very small percentage of Nigerians are covered by health insurance. Because we have poor uptake, the HMOs are strapped for cash. You have 100 people paying, for health insurance from you. They are paying a relatively low premium, and 60 of those people are accessing the care on a regular basis, which means that the HMOs are only able to pay very low rates to the hospitals. Because the HMOs are paying low rates to the hospitals, some hospitals are making a difference between how they care for their private patients and their HMO patients. Even the ones that try not to make too much of a difference are trying as much as possible to save cost on providing care. And then this is leading to poorer outcomes, which is one of the big problems that we're trying to pull ourselves out of. These poor outcomes are fueling the loss of trust in the healthcare system in Nigeria. Now people are afraid, when you go to the hospital, this and this can happen. And so fewer people are taking on HMOs, and the cycle is continuing. And we need to find our way out. So how do we break this vicious cycle? To break this cycle, we're going to need to increase confidence in the healthcare system, which we've already spoken about earlier. People need to trust that the outcomes will be good. We need to also educate the Nigerian population about the benefits of health insurance and why health insurance is not a benefit. I don't know if that makes sense. So most of us who have cars have to have car insurance. And when the year is coming to an end, if you've not used or claimed anything from your car insurance, you don't just go and bash your car so that you can make a claim. Now, we need to understand this as a people, that even if you've not needed to use your health insurance for the year, it's not a reason not to subscribe the following year. It's also not a reason to suddenly turn up in the hospital. This utilization is what is increasing the cost of providing care for everybody. We also need to keep utilization low, which is part of what we're talking about. And the health insurance companies do have a part to play in helping keep utilization low. They should reward low utilization if they can. People who don't use their insurance should be able to pay lower premiums. People who don't use their insurance should be given access to maybe to gym subscriptions, things that they can do to encourage people to only use the insurance when they need it and keep the utilization rate down. If we can work all these things together, we will be able to slowly find our way out of that vicious cycle that we are in now. The patients, what can we do as patients to help improve the quality of care? As Nigerians, we need to improve our health-seeking behavior. We need to think more of preventative care as opposed to curative care. A lot of Nigerians wait till they are very sick before they even go into the hospital. You see that your father developed hypertension at 45, you're turning 45 and you've never gone to the hospital to check what your blood pressure is like. We need to understand that a lot of things are genetic, a lot of things are hereditary. And so if you know you have a predisposition to any illness or anything, make sure that you find out and you get in front of it, not when you are gravely ill. It's important that we understand that most Nigerians are one serious illness away from bankruptcy. And a lot of these illnesses can be avoided if they are picked up early. So you start showing symptoms, don't go down to the pharmacy and self-medicate till you can barely move. By the time you can barely move, the cost of care for you will be significantly higher than it would have been if you had gone in when you felt the first symptom. And it's likely that your health insurance would have covered you at the beginning and may not be willing to cover you at the point where you're going in sick and almost dying. It's also important, like I said earlier, to remember that health insurance is not a benefit, it is insurance. It is there to protect you when you need it. And so we use it when we need it, and we use it wisely. We should all stop self-medicating. I can't emphasize this enough. It is a really bad habit that we have as a country. I don't know how we're going to find our way out of this one, but as much as possible, doctors and pharmacists especially should encourage people to get a professional opinion before they treat. Medication compliance. This seems to be a very unusual but common problem in Nigeria, where people stop taking their medication once they start feeling better. I don't know if it's a problem in other parts of the world, but it's definitely a problem here. The doctor has said, take your antibiotics for 5 days, and after 3 days, you're feeling better, and so you stop taking your antibiotics. The truth is, these behaviors lead to resistance, which mean that there are more and more viruses and bacteria out there, more bacteria out there that are now immune to the more common drugs. And it means that we need to start bringing new drugs into the system. And all these things continue to increase the cost of healthcare. So even as patients, this is the part that we have to play in all of this. And finally, the government. What can the government do to help improve the quality of care? Well, the government can help sponsor QA programs for the smaller government hospitals and clinics. Little things that will improve the quality of care for the patients, improve the experience of being in the hospital, make it a less unpleasant experience for the patients coming in. Programs that more funding for the government hospitals, so that the government hospitals can improve the kind of care they can provide in terms of training and development, in terms of equipment and facilities, and also in terms of outreach and information. Speak to the people in the community, educate them on the different illnesses that may be plaguing their community or the hereditary diseases that are common in that area, and how to stay on top of it and how to stay safe and things like that. The government also needs to help us provide more opportunities for our doctors to specialize. Because while we're losing a lot of doctors to the diaspora for financial reasons, we're also losing a lot of them because there are no opportunities for them to specialize. These doctors you have people who have been working as medical officers, GPs, for 4 5 years, and they want to specialize. They're intent enough to specialize, but there are just not enough spaces. So the government can partner with big private hospitals, like I think they're already doing that with a couple of big private hospitals, to help increase the opportunities for people to specialize. I think this will help us keep more doctors. Then management courses for healthcare workers. This seems to be a global problem, but even here in Nigeria, a lot of doctors are very focused on the care of the patient, which is very, very important and good. But if you don't understand the economics of caring for your patient, then your hospital, clinic, your healthcare outfit is not profitable, is not sustainable, and will shut down. So it's important that while the doctors understand that, yes, the priority is the patient, keep making that patient a priority. Part of making the patient a priority is making sure that the next time that patient is ill or needs healthcare, that your facility is still available. And the only way your facility is available is if it is sustainable, and it's only sustainable if it is profitable, or at least breaking even for the non-profit. It needs to at least be able to break even and pay all its bills. So it would be nice if there were more courses available, not so pricey, for healthcare workers to be able to understand the economic side of healthcare, especially for those that work in the private hospitals. So you understand that even though the result of a lab test might be interesting to see, if it's going to increase the cost of healthcare and it's not going to change the treatment for the patient, maybe don't do it. Leave those sort of tests to the teaching hospitals and the research hospitals. Finally, health admin courses. This is something that is very often downplayed and not appreciated, but the admin part of healthcare is very, very important. I think one of the reasons why Paelon has been able to grow as quickly as it has is because apart from having me as a non-medical administrator of the hospital, our managing director also has an MBA. So apart from seeing Paelon as a hospital, we're able to see it as a business. And this is very, very important. We don't have hospital administration courses in Nigeria. We don't have people who are going out there and training to come and run hospitals. We have the usual where the doctor runs the hospital. And at the end of the day, the doctor is going to see things from a medical perspective. So it's very important that you have that balanced view. And so more healthcare admin courses will definitely go a long way in improving the quality and the sustainability of hospitals and healthcare in Nigeria. So looking to the future ahead, like I said, more opportunities for doctors to specialize, management courses for healthcare workers, and health admin courses. If we're able to put all these things together, we should be able to improve the quality of care that we get as a people over time, and redefine healthcare in Nigeria. Thank you.
Thank you so much, Unoma. This is wonderful. Audience, I encourage you to send in your questions. Please type them into the chat box. But I do have a question here, and they wanted to know, can you speak more about why quality improvement programs are so important?
I'll be very happy to. So the importance of a quality improvement program, like I listed out, if in my slides, I listed out two things in particular. I talked about SOPs and I talked about facility management. Where your quality improvement programs really make a difference is in the routine tasks, the mundane things, the things that we think are not important, but make a huge difference at the end of the day. Like the example I gave of power going out during a surgery. If you have a quality improvement program that you've gone through, the part of the program will be ensuring that you have a backup system, a generator, you will have battery powered lights in the theater and little things like that, that you may not think to have, or you may not think to put in place if you hadn't gone through the routine or had the experience. And the day that you do have the experience, those things are already there. They seem so little, in the grand scheme of things, how often does NEPA take lights during a surgery and the generator is also not working? But you'll be surprised, the day that it does happen will be the day that there's a critically ill patient on the table, or maybe just a woman in labor. And the difference between life and death will be the fact that you had those standby lights that have been there the whole time, and you're able to complete the surgery in the dark, with the standby lights. It's really, really important for the routine things, especially. The quality improvement programs make sure that you keep those routine things up to date. So fire, the little things that, that don't seem like they're important in a hospital, but can make all the difference in, like I said, the quality of care that is provided and in the outcomes that you get. I talked about my dad and coming into the hospital for one thing and us discovering that it was something else because we have the SOPs that were developed by our quality improvement program. I don't know if this answers that question. If you have any other questions about this, just please put it in the chat as well.
Thank you. So you mentioned about the low remuneration of healthcare providers, but also how important it is for clinicians, doctors, nurses, pharmacists, whomever, to keep their skills up to date, whether it's in leadership, management. And can you just talk a bit about? I know Paelon is quite keen on investing in their staff, but how about other hospitals that are smaller and maybe don't have a lot of disposable income? Do you have any tips on how they can, upskill their staff, especially when the clinicians don't have the disposable income to do so? So do you have any suggestions or tips on how they can do that without necessarily bankrupting the organization? If you could just speak a bit about that.
So one of the lovely things about working with doctors is that, like when I talk about the specializing, the doctors are, at heart, they're academics. Most doctors are happy to learn and not earn so much. And for that reason, if you cannot afford to pay your doctors what they would like, any doctor doctors are easy to incentivize with trainings. So when Paelon was smaller, we had relationships with some government hospitals and some bigger private hospitals where they would allow us send in medical officers to learn soft skills. Well, not really soft skills, but to learn skills, all sorts of skills from the hospital. So I know we had a relationship with Island Maternity, I think it was, where we would send our midwives and our doctors to go and take deliveries there and improve their skills. Because we had maybe one delivery a month or something. And so this was not a skill that they were honing very well. And so we would have this relationship, and Island Maternity wasn't charging us in the beginning. And so it was something that we were able to do. It didn't cost us anything. And I know that it was a skill that our doctors and our nurses, midwives were very happy to have. So training is definitely one good way you can help. Then if you can give them access to specialize, most hospitals are led by doctors, and most of the doctors that are leading these hospitals have specialized themselves. So it means you have one or two, you have relationships in Luth, you will have relationships in some of the other specialist hospitals and the teaching hospitals. And so if you can help your employees after a few years with you get in some of these programs, those sorts of things will definitely keep them motivated before your hospital is able to grow.
Thank you. So we have another question here. It says you spoke about HMOs as being a key player in building, health. Gosh, I'm confused by this question. In building future health relationships. Can you speak about how hospitals can establish relationships with HMOs?
So establishing a relationship with the HMOs is not very difficult. At least for us, what we do is if the HMO doesn't approach us first, we would just write in a letter. And it's actually a fairly simple administrative process. Most HMOs are happy to establish relationships. So I don't know if you're talking about the regular hospital hospital HMO relationship, or a closer relationship like the sort I think Hygieia has with like Lagoon. Now, for those more complicated relationships, that will take a very long time to explain how to establish. But for the simpler ones, all you need to do is write into the HMO, send them your price list and the list of services. They would often send somebody to inspect the hospital and be sure that you are at least registered with HEFEMA, to be sure that you are up to date on all your licensing and your doctors and nurses or have all their licenses. And then they would also probably negotiate your prices with you. And then once you've settled on a price that works for both parties, they sign you up and start sending patients your way.
Okay, thank you. So we have a comment here that says administrative skills and medical skills are a powerful combination for success. Maybe I'll just add a bit to that comment. Can you talk about why? So you spoke a little bit about why it's important to do like the quality improvement programs and why it's important for healthcare providers, especially in a leadership position, to have the requisite financial management skills. But can you talk about why having administrative skills is a really important factor if you're going to be running a profitable and successful institution?
Okay, I'm going to use, I'm going to try and illustrate this. So let's say we have a patient who comes in off the street to do, he's been in an accident, he's been hit. He comes in off the street, and obviously the first thing the doctor is thinking is, I need to save this man's life. And so the doctor takes the patient into the ER, they do everything they need to do, and they stabilize the patient. Now they ask the patient about, okay, do you have health insurance? The patient doesn't have insurance. The patient can barely afford to pay for what has been done so far. And obviously, because this patient has been hit by a car, they need maybe orthopedic surgery and a couple of other things, to get to a point of complete rehabilitation. Now, the doctor is faced with a conundrum. The doctor has to decide, am I going to treat this patient for free? Because clearly this man cannot afford to pay whatever fees it is that we have in our hospital. Or am I just going to leave this man to lose his leg or his arm or whatever? Now, the sort of doctor that you want is a doctor who is ready to treat the patient for free, right? You want your doctors to put the life of the patient before anybody else. By the time your doctors are getting to the point where they are putting money before the life of the patient, then you are losing a very key aspect of being a doctor. So you want your doctors to put life first all the time. And so this is where the non-clinical staff come in. Those of us who are not doctors don't have to put life first, right? So you have your doctor who is the person taking care of the patient, and his prime focus is to save this life. The admin team's prime focus is to save this business. And so we are working together to a common goal. So I know that my doctor is out there making sure that this man is getting the best possible care, regardless of whether he can afford it or not. And so with that comfort, I can now safely look at, okay, since he can barely afford what we've done so far, where can he afford to go? Right? So the doctor tells me he needs this and this and this to be done if we're going to save the leg. And I say, okay, since he can't afford to have it done in Paelon, where can we send him to? Can we send him to Igbobi? Do we know somebody in Igbobi? And then the admin part makes sure that, okay, the patient is sent over to Igbobi. And then the patient is still paid. The patient still pays for what they've done, even if we need to develop a payment plan. So that at the end of the day, you don't have a hospital where you are treating everybody is surviving, and at the end of the month, there's no money to pay your doctors. There's no money to pay your nurses. And because the truth is, the joy of saving lives is not going to keep your employees with you. They are happy to save lives, but they also need to take care of their families. And so having both aspects working hand in hand is very important, because when you get to the point where your doctor is actually ready to turn back a patient himself for financial reasons, like I said, a part of him being a doctor is going away from him, right? You want that person to have that human empathy throughout, so that you know that the patients are getting the best possible care. And so let's not say wicked parts of the job can be left to the non-medical people. I hope this is, as I've been able to explain this well.
Yes, yes, I think that's very important, understanding the balance between, the administrative side and actually still, being able to be a healthcare provider, especially in our context. It can be very, very difficult with many patients not having, insurance or the ability to be able to pay. So it's how do you strike that balance while still making sure you provide care for your patients and keeping your organization afloat? So we have another question here, and they ask, how, as healthcare providers, do we improve health-seeking behaviors from our patients or future patients, rather?
So this is education. And in this one, I would say charity begins at home. My friends all know, I do my best to educate them about healthcare. They would make jokes and call me doc sometimes, even though they all know I'm not a doctor. But it's literally from education. It's going to be one man at a time, one patient at a time. Every time you have a patient who's coming, who's been self-medicating, show them the downside of what they've done. Show them how much time they've lost. Oh, so you've been sick for 2 weeks and you just came in now. You've been taking what's this one called, Zithromax, and meanwhile the bacterial infection you have is only responsive to something else, and now you're going to build give them the facts, explain to them why they should not be self-medicating. Then when you see people who come in with high blood pressure, you find out from their family history, oh, my dad has had high BP. Educate. Why didn't you come in earlier? Explain to them what difference it would have made to them if they had started treatment earlier. If they had, maybe they wouldn't have even needed to go on treatment. If you know your father has hypertension, you are at risk for hypertension, the doctor might have been able to give you a list of lifestyle changes you could have made to make sure that you don't ever get there. But you see, if you don't come on time, then you get to the point where you're on chronic medication for the rest of your life. So we literally just need to educate people as much as we can. Tell them every time, as every opportunity we get, come to the hospital when you first feel a real symptom. Don't come to the hospital if there is nothing wrong. Nosocomial infections are very real. Don't come in if there's nothing wrong. If you haven't used your insurance all year, that is a good thing. It means you are healthy. Encourage people to do health assessments. So you haven't been sick for 2 years, no known pre-existing conditions, do a health assessment. And then that gives you confidence for at least another year that, okay, it's very unlikely that anything horrible is going to go wrong with my body in the next 1 year. And so, I can stay safe, stay healthy, so I think that's the best we can do, educate.
Wonderful. So we have another question here, and it says, concerning quality assurance in a hospital, who would be the best person in the hospital to carry on the task? In other words, what is the criteria of a person who is expected to ensure standardized care in the facility?
So I found that the best sort of person for quality assurance would have to be somebody with a medical background. I think if we had trained hospital administrators in Nigeria, you could also use a trained hospital administrator, because it is so. To be in charge of quality assurance, you need to understand the operational side of the hospital a little bit more than a non-medical person would. So any medical person, really, a nurse. I think our quality assurance manager in Paelon is a nurse. She's a trained nurse, and a nurse would do a good job. But then it's not a one-man job, right? It's not a one-man job, because yes, the nurse will understand the clinical part of the quality assurance, but then part of quality assurance is human resources. For example, part of our QA was that we needed to develop an HR policy. We needed to develop a facility management policy. These things are not medical in any way. So quality assurance would be done by a team for any hospital. You will need your clinical team, and you will need your non-clinical team. And the truth is, if you want to really get the best, you should have one person in every department who handles quality assurance. What we do in Paelon is we use our heads of department. So every HOD is responsible for quality assurance in their department. Whatever is required by the QA manager, you are end responsible as the head of the department. That way, I mean, she's a nurse, she's not a pharmacist. She may not understand the details and the intricacies of quality assurance in the pharmacy as well as the pharmacy manager would. And so they would work together to make sure that the quality in the pharmacy is on top. But for the manager themselves, somebody with a bit of a clinical background is definitely better than somebody without, even though a non-clinical person can do it too.
Okay, great. So we have just a few more minutes and we want to wrap up on time. We spoke a bit about, about trainings and how important it is. And I guess we'll get to that in a minute. But I wanted to know if you had any closing remarks for us, and if anybody wanted to find out more information about you or the work that you do, where can they find you?
Closing remarks, I'll just say, let's all, we're all stakeholders in this, because even if you're not in a healthcare provider, you're not a health insurance or a part of the government, you are a patient at some point. So we are all stakeholders in this. Let's all do whatever we can to help improve the quality of care in Nigeria. And if you want to find, I'm on LinkedIn. That's probably the best place to find me. And find all the things that I do. Paelon also has a website, but I don't think the website talks too much about the people who work there. It talks about our services, and it tells you a lot about what we do and what we're getting up to at every given time. But to find out more about me, I'm on LinkedIn, Unoma Grant, I'm very easy to find. And Paelon's website is www.paelonmemorial.com for any information you want about the hospital. We're also on Instagram, and Paelon is also on LinkedIn.
Unoma, thank you so much for this very insightful, very interesting presentation. I just want to take a minute, just because you've actually spoken a lot about, the importance of training, leadership and management training, even financial management training, for healthcare professionals, anyone that aspires to own a hospital, anybody that is managing a hospital or plans to be a future hospital leader. I think it's very, very important, as our guest has said, to invest in yourself. As I said earlier, the HLA is a leadership management and quality improvement training institute. And as such, we have some of these programs. Unoma made a very good point about a lot of the programs that you see out there, they may not necessarily be context specific. So they may not understand what's happening in our very complicated landscape. As you spoke about, lack of water, lack of power, lack of manpower. There's so many things that are different for us than it is in the West or other parts of the world. And so I think that it's very, very important, as those of us that are on here that may be looking to invest in ourselves in the future, to look at programs that are context specific and are relatable, that understands some of the pain points that we have in this part of the world, So I think that is a great segue just to talk 1 minute about the HFM program that the HLA offers. One of the faculty members, Rosemary, is on. If you could just speak 1 minute about HFM and what we do and how people can join, we'd really, really appreciate it.
Sure, thank you, Emily. Good afternoon, everybody. My name is Rosemary Gwebike. I am one of the faculty members for the Healthcare Financial Management Program. So we've talked a lot about training, we've talked a lot about investing in ourselves. And in this part of the world, it's not something that we do as often as we should, but that's why we have organizations like HLA. One of the programs that we run is HFM. It's actually a 4-week program. It used to be, it's actually a 3-day in-person program, but no thanks to COVID. It's currently a 4-week program whereby it's a synchronous and asynchronous learning, whereby you have your own work to do during the week, and then there's a 2 to 2.5 hour session with the facilitators, myself and Adeshola Gunrede, just giving you real life experiences, case studies. So we're not just giving you the theory aspect of it, but we're also giving you real life experiences, and that you take back with you and you will apply in your hospitals. We typically recommend this program for hospital owners, anybody in the healthcare space who wants to expand their financial management knowledge, CMDs, just anybody in the healthcare world who wants to understand the financial health of the organization. We typically recommend this program. It comes at a cost of $49,999. In my opinion, but again, my opinion, it might be biased. In my opinion, it's actually very little for what you're going to get in the program. So I recommend HFM to everybody. The next cohort is from February 15th to March 12th, 2021. Please go on our website, hlaafrica.org, and sign on. Or if you need additional information, please feel free to reach out to any of us. I'm more than happy to supply you with that information. I hope to see you guys in the next HFM cohort. Thank you, Emily.
Thank you so much, Rosemary. Unoma, thank you so much for a wonderful and insightful presentation. I really, really enjoyed it, and I believe our audience did too. Again, you can find her at Unoma Grant on LinkedIn, and you can also look up their hospital if you have any questions. Everyone, thank you so much for your time today. Rosemary, thank you once again. Please have a wonderful day. Thank you.
Thank you, Emily. Thank you.
Thank you.